I see a lot of young people in the room. And I thank the youth band for that number and also for their passion in the talent that they hold. And they continue to inspire other young people to fan your talents so that you can earn yourself some income and also look after your family well. I've got this just inside me. Tomorrow is the International Women's Day, and I've got several pins on my coat. The yellow one is for child protection, and the purple one on the side is about safety of women and children. That is celebrated internationally tomorrow. Because we were in Parliament this morning, we were forced to wear the shirts because tomorrow there will be no Parliament meeting. But I see a lot of young people in the room, and I am positive that we can fight this fight together, because our young people are dying, our relatives are dying, our Fijians are dying, and dying very young, because of one cause is HIV, AIDS, and also because of the abuse of the use of illicit drugs in our country. I've got a speech prepared for me to read. I'll try to be professional with it, though. The champion of the HIV AIDS in our country is not here, but we want to acknowledge the work that His Excellency Ratu Epeli Nele Tikau, our past president and ambassador for AIDS in Fiji, the work that he has continued to do in this fight against HIV and AIDS. International Program Coordinator for the UNFPA's Transformative Agent Program, Mr. Brian Kironde. The Chair and the esteemed members of the HIV Task Board, representative of partners, civil society organization, faith-based organization, and target population, invited guests, ladies and gentlemen in the room this morning. A good morning and a bulabinaka to you all. Today marks a crucial step forward for our collective effort against the HIV epidemic and the associated challenges posed by sexually transmitted infection and unplanned pregnancy for our beloved Fiji. As we gather to launch the National Condom Campaign initiative today, we do so with a renewed sense of purpose and urgency in light of the troubling statistic of HIV that surrounds us. The global landscape, ladies and gentlemen, of HIV and AIDS remains stark, with approximately 39 million people worldwide affected as of data of 2022. Sadly, this is not just a distant reality, it touches our shore, with Fiji currently positioned as the second fastest growing nation for new HIV cases in the Asia-Pacific region. The alarming rise is newly diagnosed cases that Mr. Brian has mentioned, 1,093, just between January to September last year. And the government has declared the national outbreak of HIV in Fiji in the last few months. These figures compel us to take decisive action to safeguard the health of our communities, with special focus on those most vulnerable to this epidemic. In response to the National Condom Campaign initiative that we are having here today, the National Technical Working Group, led by the Ministry of Health and Medical Services, has been diligent in preparing for a national condom campaign that we are launching today. This initiative is geared towards fostering a culture of safe sexual practice while simultaneously reducing the prevalence of both sexually transmitted disease, infections, and unplanned pregnancy within our population. The establishment of a dedicated group of appointed agents will play a pivotal role in the realization of the campaign as they work tirelessly to distribute condoms and disseminate essential educational material throughout Fiji. Our goals are clear and urgent. We aim to significantly increase awareness about the critical importance of condoms and the condom use. We seek not only to distribute free condoms, but also to provide comprehensive education on their proper use, thereby promoting a responsible sexual health practice, as alluded to by Mr. Bryan this morning. The appointed agent will be our champion in this endeavor, taking on the responsibility of distributing condoms at designated location, engaging in peer-to-peer education, and disseminating vital information regarding sexual health. This is more than just a campaign, ladies and gentlemen. It is a vital public health initiative targeting specific demographics within our communities, notably the university students and the nightlife patrons who are at increased risk for HIV and other sexually transmitted infections and unintended pregnancies. By focusing on this high-risk group, we are committing ourselves to the principle that accessible education and resources can lead to a positive behavioral change and can ultimately help reduce the transmission of this infection in our nation. As we embark on this journey, I am pleased to announce that we will be launching our campaign at 63 strategic chosen sites across the country. These sites have been identified based on their accessibility and their potential to reach diverse demographics. Among them are 18 educational institutions, which include 13 campuses of the Fiji National Universities and 5 campuses of University of the South Pacific. In establishing a presence of our educational institution is crucial. It allows our trained team to engage with our youth, providing them not only with the tool they need to protect themselves, but also with the knowledge to navigate their personal experience safely and confidently. In addition to education institutions, we also recognize the influence of social setting on health behaviors. Therefore, we are targeting 15 nightlife areas, particularly 15 nightclubs in Suva, where many youths and adults gather to socialize. Here, we will be promoting safer sexual practices among club goers by ensuring that condoms are readily available and the message of responsible behavior resonates within their energetic environment. The nightlife scene is a vibrant part of our urban culture, and it is essential for us to blend health awareness with the enjoyment of life. Public facilities play a pivotal role in our campaign as well, ladies and gentlemen, and we are establishing condoms access point in 5 public restrooms, making it easier for individuals to prioritize their sexual health in a discreet and convenient environment. This move is a testament to our committing to removing stigma surrounding sexual health. We believe that everyone deserves easy access to resources that protect their well-being. Moreover, we recognize the need to extend our initiative to accommodations that cater for both locals and tourists. This, we are collaborating with 19 hotels in Suva, known for providing short stays, to ensure that visitors and residents alike have access to condoms during their time in these establishments. This collaboration is not just about convenience. It's about sending a clear message that safe sex is essential wherever one may be. Lastly, our commitment to health extends to 6 health facilities, including health centers and hospitals across Suva and Valley Lebu subdivision. These facilities will not only serve as a critical access point for condoms, but will also provide essential health services and information. By integrating our initiative with health services, we are ensuring that we meet the needs of those who may require further guidance and support regarding sexual health. To implement a successful campaign, we will utilize multifaceted strategies targeting the hotspot where our vulnerable lies. Through rigorous outreach effort, including informative material workshops and partnership with local influencers, we will engage with our communities in new and impactful way. Also, social media, ladies and gentlemen, the social media platform will serve as vehicles not only to information dissemination, but also a space for interaction and feedback, fostering a sense of community responsibility surrounding sexual health. We will rely on robust partnership among government ministries, civil society organizations, educational institutions, and a key community representative to ensure that this campaign is carried out effectively. The establishment of a technical working group will facilitate targeted logistic management, advisory efforts, and continuous monitoring and evaluation collectively during the initiative towards its intended outcome. As we undertake this important journey together, we may be steadfast in our dedication and promoting safe sex practices and ultimately achieving a Fiji free from the burden of HIV and other sexually transmitted infections. In this fight, we must acknowledge the medical, social, and moral dimension of this issue. We as a nation of faith, and our faith drives us and pulls us together. From a Christian perspective, sex is a sacred gift intended for marriage, where love, commitment, and lifelong faithfulness form a foundation of a stronger family. Bible calls us to honor our body and uphold moral values that protect not only ourselves but also those we love. Abstinence before marriage and faithfulness within marriage remain the best way to prevent HIV and other sexually transmitted infections. It is a tool that we must not ignore, but also promote for our young people. However, in light of the reality we have with us in front of us today, including the rising number of HIV cases, condoms play a crucial role in harm reduction, particularly to those who may not yet be ready to make this long life commitment. Fiji is a multiracial and multicultural society, and we must approach this issue with understanding and compassion. Our young people are the future of this nation, yet many face risk of early sexual activity, which can lead to HIV, unplanned pregnancy, and lost opportunities and education. These challenges places a strain not only to individuals and family, it also places strain on our health service delivery. We struggle to manage the rising burden of HIV-related illness. We must continue to promote access, responsible choices, and access to health care while encouraging strong moral foundation. In conclusion, ladies and gentlemen, let us remember that today's launch is not merely a ceremony or a ceremonial occurrence, but rather a commitment to our people, ensuring they have the tool, they have the knowledge, and they have the support needed to lead a healthier lives. Together, we as a nation, we can protect our young people, our youth, and strengthen our family and ensure a healthier future for all Fijians. Thank you for your attention. Thank you for your commitment in the march this morning. And thank you for being here, your unwavering support as we embark in this critical mission for the health of our nation. I urge all of you to embrace this mission with enthusiasm, understanding, and dedication. Together we can cultivate an environment where safe sexual practices are normalized, where individuals feel empowered to make informed decisions about their sexual health, and where public health is prioritized. Let us work hand in hand to create a healthier future for ourselves, for our families, and for our nation. Nawalevu, Danebad, and may God bless Fiji. Hey.